What we're going to do now is look at the prosthetic components, and you were all given or you're going to share a Cybron Pro Series kit. These are just the hands-on components. And you're going to see some instruments or product in the little bins, and you're going to see little pictures here. And let's just take a few minutes and demonstrate each of these. The first are the healing abutments and the cover screws that will go into the implant. So first, in your lower right hand side, there is a hex tool. And a hex tool just has a little notch on it. And let's simply take one of our healing abutments, kind of lock the hex tool into the little notch inside the healing abutment. We'll go to our model. Let's work over here and simply thread it into position. And it's tight. Remember, we can torque that into at 15-25 Newton centimeters to hold it in place. Now, if we wanted a little bit taller healing abutment, we'll simply unthread this one. It will allow you some time to do this. We're going to do the same thing. Take your hex tool and we'll go to site and simply thread it into position. You can see that's a little bit taller. Now, we can use these healing abutments if we get to 25 Newton centimeters, as we said throughout the course. But if we don't, if we're 15 Newton centimeters or less, we may want to simply bury that implant and let it heal. And here we're just going to use a cover screw, which is a flat screw. And what's nice about the Cybron system is that cover screw is included with your implant. You can see here it's underneath the gum. So we can thread those in and out, and you can see the differences in the product. There's two techniques for impressions. One is a direct and one is an indirect impression technique. And if you get the parts out of here, this is the direct, meaning we're going to place the impression coping, impression abutment into the implant, engaging the hex, and we will then make an impression. When we pull out the impression coping will stay in the mouth. We'll have to unscrew it and actually physically put it into the impression. So this is two pieces. There's a screw, and you can see the notched area or the internal hex design. And we'll come over to this side and we'll simply lock it into place, take your hex tool, and tighten it in the mouth. Now, you'll tell your patient at this point not to bite down hard because they could do a lot of damage to the implant. I like to put a flat side, and you can see these impression posts have a flat side. Be consistent, either all facial or all lingual or all distal or all mesial, but get in the habit of being consistent because it makes it easier to replace it into the impression. Now, for those times where you don't want to use an indirect technique, a direct technique, excuse me, we want to use a direct technique. This is a second type of impression post with a longer screw. And you can see that this screw actually threads into the impression post so that it becomes one piece, so it won't fall down into the patient's mouth. Here's the hex, and we'll go to the other side here, and we'll place it and tighten this down. And again, I use the flat side towards the facial, as you can see. Now, this is a little bit different in that when you take your impression, you're going to make a little hole in the impression tray itself. You'll make the impression, then you will unthread this impression coping, and it will come out in the impression, so you don't have to replace the impression coping in the impression. You know it's very precise. So we'll play with that a little bit. Just a few more things to review here. There are several different types of abutments that we can use. The first one here is a straight abutment. And quite simply, again, there's an internal hex, and there is a small screw, and we'll simply go to site, kind of lock it into that hex, and go ahead and play with this, and then we just kind of tighten that screw into the implant. And that's called a straight abutment. As we showed you in some of the cases, this will engage the top of the implant itself. So it will look seamless when you take an impression. Another type of abutment is called the platform switching abutment, or platform switch abutment. And basically the same concept, two pieces with a screw. However, this abutment only engages the internal diameter of the implant. And we will discuss platform switching and what that's all about if we haven't already. So it's not engaging the outside of the implant, rather it's just the internal design. Theoretically, that's giving us better healing of bone and minimization of troughing of the bone around the implant. These abutments are sent to the lab and they can be prepared because they are engaging the internal hex design of the implant. Okay, further down the list we have the direct platform switch abutment. Now this is a little bit different in that it's one piece. There's not another screw on the inside, and you're going to have to use the other tool in the lower right hand area, and this will simply thread into the implant. Now this is not engaging the hex. It is not engaging the hex, so it would be ideal for multiple units. You could place that during the time of surgery, place the abutment, and then put a little healing cap or a cap on top of that, and the patient would leave with that type of appliance. But remember here, it's not engaging the hex. So you probably wouldn't want to use this for single units. Solid abutments, again, very similar. Not engaging the hex. Popular with some systems, and we're simply threading it into position. Now this is left in the mouth. We don't need to take that out of the mouth, and to take the impression, we have an impression cap which will snap on, and the impression is taken and this cap will come off. You can temporize that immediately. Again, it's not engaging the hex, so probably not ideal for single units. And finally we have our UCLA, which is all custom made. When they talk about a custom abutment, this is what they would be using. You have a burnout sleeve. This is done by the laboratory. This is not something you would do. You would provide the laboratory this, or they would purchase it, and they would simply come to site and they would prepare this, wax it, and you could have a cement-on crown or a custom-made abutment that's easily made. So these are the prosthetic components for the system. As you can see, it's quite simple, it's not overly complicated, and certainly something that you can manage quite readily.